Hi, good afternoon, Erie County. My name is Gail Burstein. I'm your Erie County Health Commissioner, and we are here today to give you the Erie County COVID-19 update for June 17th, 2020. So just to remind everybody that we are providing the most updated information that we obtained about an hour ago. So this is a rapidly moving situation, and so what we tell you today may, at this very moment, may not be true in an hour from now. So if you want the latest, go to our Erie County website to give information around COVID-19 at www.erie.gov/COVID-19. So first, let's talk about the numbers. So as of last evening, in terms of COVID-19 cases in Erie County, there were a total of 6,749 total positive cases out of 102,663 specimens that were tested. Unfortunately, there were 608 people who died of COVID-19, and we just want to reach out to those families and their loved ones and provide our condolences. Really sorry. It's very, very sad. And I just want to clarify, these are all laboratory confirmed COVID-19 cases. On June 15th, there were 67 individuals admitted to Erie County hospitals for COVID-19, and of those, 22 were in the ICU and 15 had airway assistance. And so this is looking at the data of hospitalizations for all of Western New York, so all the 5 counties in Western New York region from as of June 17th, 2020. And so you can see that in the blue bars correspond to the total number of people admitted to the hospital with COVID-19, and the yellow bars are the total number of people admitted to the ICU with COVID-19 in Western New York. And so you can see it's very obvious there is a pretty significant decline of the total number of hospitalizations for COVID-19. We're also slowly trending down for ICU admissions, not as rapidly though. Those individuals are pretty ill. So this is looking at our own Erie County hospitalization data from June 2nd to June 15th. And you can see that in the blue line is corresponding to total hospitalizations. There's been a significant decline over the past couple weeks. Specifically, between Sunday and this past Monday, there were a decrease in 11 patients admitted to the hospital. So we're still continuing to see a significant decline in the number of patients admitted to our Erie County hospitals for COVID-19. The red bars corresponds to the number of people admitted for COVID-19 in the ICU, and the yellow is looking at the number of people receiving some type of airway assistance. And you can see those are all declining, although it's a much slower decline. And then the purple bar is corresponding to the number of people who had died in the hospital from COVID-19. And you can see that is also staying at a very low number. So this is looking at the demographics of our Erie County COVID-19 cases by age along the x-axis, and then by gender, where females are in yellow and males are in blue. So you can see every adult age 20 and up, we're seeing still significant numbers of COVID-19 diagnosed. In the kids, the teenagers 19 and below, and also the school-age children and infants, we're seeing much lower numbers. We feel that that's probably an artifact of testing, that we know that for some different variety of reasons, children have a less likelihood of developing symptoms for COVID-19, and so we believe a lower number are tested. However, we do know that children can be infected with COVID-19, and so everybody is at risk. And then this is looking at our COVID-19 cases in Erie County by gender and also by residences. So you can see on the top box, looking at the COVID-19 cases by gender, we still continue to have slightly higher proportion of females diagnosed compared to males. And then in the lower box is looking at the residents of the people diagnosed with COVID-19 in Erie County, where the top row is corresponding to the people who lived in Buffalo, and the second row is corresponding to the people who lived in Erie County outside of Buffalo. And so you can see there is a disparity, whereas 27 or about 28% of our Erie County population lives in the city of Buffalo. Those Buffalo residents account for about 45% of our COVID-19 cases. So we're seeing a much larger proportion of compared to the population of among people living in Buffalo with COVID-19. And then this is looking at the number of COVID-19 diagnostic tests. So that's the nose swab that's telling us if people have a virus detected in their nasopharynx, which is indicative of their airway, and looking at the proportion of positive tests. So you can see in the blue bars that we're doing almost 20,000 tests a week in Erie County, and still the proportion of positive tests is declining significantly, whereas the week ending on June 13th, only 1.7% of all the tests that we did were positive for COVID-19. So that's the direction that we want to go. And actually, just looking at our data so far this week, that percentage dropped to 1.2%. So we're still continuing to do a good job. So remember, you have to keep masking, social distancing, washing our hands. Those are key. And then this is a slide looking at the COVID-19 antibody testing in Erie County, whereas the first column is looking at the week that the antibody testing was done. The second column is looking at the total number of antibody tests done. The next column is looking at the positives, and then the last column is looking at the proportion of positive tests. So you can see so far in Erie County, we've tested a little more than 60,000 Erie County residents for antibody. So that's about 6.5% of our Erie County population, and of those, almost 7% tested positive. And that proportion of positive tests has been declining over time, whereas this past week that ended on June 13th, only 5.5% of people who are tested positive for antibodies. So what that means is there's still a lot of people who haven't been exposed, who haven't been infected, and so there are a lot of people that are vulnerable to getting infected and very, very ill. And this is looking at our mortality data from COVID-19 in Erie County by age along the x-axis and by gender, where females are in yellow and males are in blue. And so you can see, we're continuing to see the trend where it's our seniors that are really the most vulnerable, especially people in their 60s, 70s, and especially in their 80s. So I think that what tells us is that even though our proportion of positive COVID-19 tests is decreasing, so we're seeing less COVID-19 transmission in the community, it's still here. It hasn't gone away. We're just doing a better job preventing transmission in the community. But we still I want to make sure that we protect our seniors. They're very, very vulnerable. They're accounting for the vast majority of our deaths. So if you have a family member or a loved one, or you're a senior yourself, you might want to continue to stay put at home, not have a lot of visitors or any visitors, and if you do, make sure that you have a good social distancing and everybody's wearing masks, and keep it to a small number. And this is looking at our COVID-19 mortality data in Erie County, again, by residents. And you can see that in the middle column is looking at the proportion of people who unfortunately died of Erie County from COVID-19 who live in Buffalo, comparing to the next column, the proportion of people who in our population who live in that area. And you can see that they're very similar. And here we're not really seeing very many disparities. That it's a similar proportion of our COVID-19 fatalities who live in Buffalo as is to the proportion of the population that live in Buffalo, about 28%. So this is looking at our COVID-19 mortality data in Erie County by race and ethnicity, and comparing the proportion of fatalities of each race and ethnicity compared to the proportion of people who live in Erie County of those race and ethnicities. And again, you can see that we don't have very many disparities there among those who are classified as white, account for about 80% of our COVID-19 fatalities. fatalities, and they also account for about 80% of our Erie County population, where those who are classified as Black or African American account for about 16% of our COVID-19 fatalities and account for about 15% of our Erie County population. So again, we've really tried hard to keep people as healthy as possible when they are infected with COVID-19 and trying to prevent transmission. And I think these data really show that we have been effective in that area. So, talk about testing. So, in Erie County, we are still offering both diagnostic testing, which is the nose swab, that tells you if you have virus detected in your nasopharynx or your respiratory tract, and then you are very likely to be infected at that time, and antibody testing, which tells us if you have been exposed to COVID-19 in the past and been infected. So you call the same number for both tests, 716-858-2929 to schedule. And the diagnostic test is really open to anybody who believe that they could have been exposed, if they have symptoms and they want to know it's from COVID-19. And now we have many people who are required to get tested for their job. So, for example, people now who work in spas and nail salons need to get tested. So there is no cost to those who are tested. You don't need any type of lab rec or doctor's order. It is by appointment only, so we really encourage people to call. And we also encourage people who make an appointment to keep that appointment. And if you can't make it for some reason, please give us a call and let us know so you don't take up the spot of somebody else who really wants to get tested. And we have clinics throughout Erie County throughout the month. So for our diagnostic testing, we have sites scheduled through June. We're in Williamsville on Mondays, Orchard Park on Wednesdays, and then in the city of Buffalo, we're at Kensington High School on Thursdays. So if people want to get tested for a diagnostic test, those are the places to go. Give us a call. We also have antibody testing scheduled throughout Erie County through the rest of the month. And so on Thursday, we're going to be in West Seneca. Saturday, we're going to be in Cheektowaga. And then next week, we're going to be in 2 different sites in the city of Buffalo. So if those places don't work out for you and you want to find a different place to get tested for COVID-19, either a diagnostic test or an antibody test, we have an interactive map on our Erie County website at erie.gov/COVID test sites. And you can click on one of those stars on the map, and a window will pop up and it'll give you all the information about the testing site, the address, the hours of operation, whether it tests for the diagnostic testing or the antibody testing, if you need a physician's order, if you need insurance, if you have to pay anything out of pocket, it gives you that information. So we have all different testing sites available on this map, including pharmacies that are offering the tests. So just want to touch on youth sports. I know that's been a hot topic lately. So again, this is the New York State, the Empire State Development, and also the governor's office sets out the regulations and the executive orders that provide kids the opportunity to play sports and dictate what sports can be played and when they can be played. So we were informed by the Empire State Development this morning that youth sports can only begin on July 6th, and that is not only to play sports, but to play games, but it also includes for practices. So no practices and no games until July 6th. And when July 6th hits, there is a limited list of sports that can be played. So on this list is baseball, softball, gymnastics, field hockey, cross country, and crew. So if it's not on the list, it is not permissible by New York State. So we've been told by the media and people from the public have been calling us to report that teams have been practicing in various fields throughout Erie County, and we just want to remind locales that schools and municipal fields could be in violation of their insurance if they allow teams to practice in violation of the governor's orders. And so they just better be careful, because if there is a problem with their insurance and there is an injury, they could be held liable and responsible for a lot of money. So remember, no practices or games until July 6th. So I am going to turn it over to Troy to talk about the parks, our beautiful parks. Just gonna spritz it for you.
Thank you, Gail.
Sure. Probably wanna.
Yeah, I don't need a stepping stool, I don't think. Glasses here. Good afternoon, everyone. I'm Troy Schinzel. I'm the Commissioner of Parks, Recreation, and Forestry at Erie County, and we thought we'd take this opportunity today to go over some updates in our parks. A lot of phone calls and people questioning what's happening in our park areas. Of course, there's over 10,000 acres for you to enjoy. So we thought we'd go over some of those as we close certain aspects of recreation, and as we open those up with each phase, we thought we'd provide some updates to our parks department today. First of all, we'll start with golf. Our golf course has been open for quite some time. We are open at Grover Cleveland and Elma Meadows. Carts are available for single rider, and recently we did open those up to 2 people per cart if you're from the immediate family living in the same household. It's still no walk-ins. Reservations are required, and we're looking at phase 3 into phase 4 about decreasing our tee times. As a social distancing method, we increased our tee times early on. We're looking as phase 3 and phase 4 about decreasing those to allow more play at the golf course as well. Obviously, to reserve a tee time, it's www.erie.gov/golf, and you can log on and reserve a tee time. Our clubhouses and restrooms will be opening starting this Friday. So we'll be opening our clubhouses for that, and we have a concession area open at the halfway house at Elma Meadows, and we have vending machines available at Grover Cleveland. So slowly but surely, we're starting to get back to the new norm, I guess, in Erie County parks. With each passing phase, we're making some changes accordingly. Camping opened last Saturday at Spraybrook Park as our camping park. Online reservations only. Again, no walk-ins. www.erie.gov/parks. Go on and make your reservation for parks. We have electric sites, non-electric sites, but they're open, and we have signage throughout the park. But well, of course, we're asking for practicing good, proper social distancing at our camping facilities as well. So now camping at Spraybrook is wide open. Bennett Beach, this is a big one. We have our lifeguards aboard this week. This Friday, we will be open to swimming. If we pass the beach test, the water test, we'll be open for swimming this Saturday at Bennett Beach. That is our swimming beach. Staff is currently out there now cleaning the beach, putting down some walkways onto the beach to improve accessibility at Bennett Beach, and we'll be open this Saturday. Of course, there's some state mandates that will be in play, like 50% capacity. Blankets and towels must be 10 feet apart from each other. As always at Bennett Beach, no dogs, no glass containers for the obvious reasons. Alcohol is not permitted, and we'll have our good friends from Evans PD and the Erie County Sheriff's Office there Friday through the weekend and throughout the summer, helping us out to maintain some of our park policies and regulations. So Bennett Beach opens this Friday. We're excited. That brings certainly another layer of normality back to our Erie County parks. Recreation, just a few lists of recreation and some things and updates where we are. Disc golf opened a week or so ago. We have 4 disc golf courses in Erie County parks, Ellicott Creek Park, Emery Park, of course Chestnut Ridge and Como Park. A very, for lack of better terms, passionate group of individuals play disc golf, and they are very happy it's back open. And of course we have signage at the first hole of all those asking for social distancing and practicing those skills as well. Basketball is open at Akron Falls, Como Park, and Spraybrook Park. Tennis is open throughout our parks, various sites throughout the area, and we're actually restriping at Emery in the next week or so, so Emery will be back open as well. Our boat launches, oftentimes people forget about our boat launches. Our free boat launches at Black Rock Canal Park and Isleview Parks are open, and our kayak launches at Ellicott Creek Parks are also open. Lastly, our dog parks, they open the same time as our disc golf courses. Black Rock Canal Park has an off-leash dog area, and so does the fantastic Ellicott Creek Island Park up at Ellicott Creek Park. That is also open as well. Trails, our trails have been open throughout all year. Our trails have been open. Mostly, we did close down for a short period at the Eternal Flame, But just some reminders about our trails, because we did experience some severe overcrowding in our parks early on, before things were open, because we were seemingly the only game in town open. To keep your safe distances from each other, wear face coverings when not able to do so at tight places like the Akron Falls and the Eternal Flame Walk. Pack a bag of hiking essentials: water, snacks, first aid, sunscreen, and wear proper footwear. Of course, we can't stress enough about the footwear. We oftentimes see people getting out of their vehicles at some challenging trails that we have throughout Erie County wearing Crocs or sandals, and honestly, that just leads to problems for us all. So please wear the right footwear. And if overcrowded, we created a new website, www.erie.gov/parklocator. Again, that's www.erie.gov/parklocator. If you pull into an area and there's a lot of cars or it seems crowded, go to that. It'll give you any park area or forestry area within Erie County that you can go to within a 10-mile radius, 25-mile radius, and so on and so forth. So use our trails. Just if they're overcrowded, there's plenty of other places to go. Shelter and building rentals, it's a big one. They are still blocked out. We still have no shelter and building rentals. We're waiting for some guidance on phase 4. Once phase 4 opens up, we will see what those mandates are and look at and see how they work with our operation and what we need to do to open our building and shelter rentals. But right now they're canceled out to July 10th. Hopefully we'll be able to reopen in the near future to those. Playgrounds. A lot of people ask about playgrounds. Most playgrounds in Erie County parks will not be open until next week. We are currently having an ordering of signs for our parks to change over. Playground's not closed. We are working on putting up those signs next week, installing swings, and of course putting in new fall zone material in our playgrounds as well throughout Erie County parks. So we're working. Hopefully by next week you'll start to see playgrounds in Erie County parks start to open. The rules for the playgrounds once they open is playground and exercise equipment are not sanitized by Erie County Park staff. We highly recommend use of hand sanitizer when using equipment before, during, and after, and of course use at your own risk. I did want to take a quick second to thank all the frontline workers, including our good friends at the health department, but I want to take a special second to thank our park staff. Our park staff throughout this whole entire pandemic have been in the field, are essential personnel, and have been coming to work daily to, oftentimes in overcrowded parks, to help monitor, maintain, and increase the level of service what we're providing in parks. I want to give a special thanks to the men and women who work for Erie County Parks. They've been fantastic, and throughout this pandemic, the ups and the downs and the changing of our operation throughout has certainly caused some stress, and I want to personally thank them as well. And just continue to follow us from golf course opens, golf course closed because of weather, to beach testing, to beaches open, to beaches closed, to what's happening next week. Please continue to follow us on Facebook and Twitter at Erie County Parks, and follow us so we can give updates like we do every day on our golf courses and certainly our beaches as soon as they open as well. Tick season. This is kind of Gail and I's both passionate. It is tick season. I mentioned hiking trails. It is tick season from our trails to our golf courses, especially if you're not a good golfer and you're like me and you're going in the tall grass. Ticks are April through November. For prevention, use EPA-registered repellents. Treat clothing with permethrin. Wear long sleeve shirts tucked into pants or tucked into socks, of course, and check for ticks removed completely. And that's checked during and after your walks, but also check your dogs as well. We are dog friendly in Erie County Parks. We have a couple dog parks, but if you're going to bring your dogs to Erie County Parks, make sure they're on a leash. Certainly more than welcome to take them on some of our trails, but just check your dogs and check yourselves before and after or during your walks throughout our parks. It is tick season. I'll turn it back over to Gail.
Thank you. Thanks. So I just want to remind people that the Erie County Health Department does more than just COVID-19. So this Saturday, we are going to have a pop-up community outreach and education day, an event at the John Canty Church parking lot on Broadway and Swinburne in Buffalo. It'll be open on Saturday from 9 till 1, and we're going to be offering our old traditional bread and butter education. We're going to be offering free confidential HIV testing. Saturday is National HIV Testing Day. We're going to be offering free Narcan kits and Narcan training. We're going to be giving away our emergency Narcan boxes to businesses and facilities that feel that they could use one. We're going to be offering free condoms and sexual health information. Our cancer services program will be there if you're interested in getting information about free cancer screening programs. And then we're going to have a lot of smoking cessation information. So remember, tobacco is a significant risk factor for severe illness for COVID-19. So this is a perfect time to consider smoking cessation. And then I want to give a very loud thank you to our Western New York Chinese Chamber of Commerce. They have been so generous with providing lunches for various organizations, facilities that have been on the front line of COVID-19. Today, they provided Erie County workers were working on COVID-19 a delicious lunch. They have several restaurants participating and taking turns providing the lunches. So really want to give a loud shout out to our Western New York Chinese Chamber of Commerce. They're doing some really great things. And then I just want to wish everybody a happy Juneteenth Day, a happy Father's Day, and I want to say congratulations to our graduates. And I know we all want to celebrate this weekend, but remember, celebrate safely and smartly. So we want to have small groups of people, preferably under 10. You want to celebrate outside rather than inside to reduce the risk of transmission. You want to limit your any type of direct close contact to individuals, and make sure that if you can, if it's somebody who's not living in your home, try to stay 6 feet apart from them or more. So again, we want to make it safe. Remember, our numbers are decreasing despite businesses opening up, our parks opening up, pools opening up. So we want to keep those numbers to decrease. We don't want to end up like those states especially in the South, that have had their numbers explode and their hospitalizations explode and them being at risk of not being able to provide hospital beds to those people who are ill. So we want to play it safe and celebrate safely. Remember, wear your masks. They are a great fashion statement. I brought my dead mask today, so they can be a lot of fun. And just want to play it safe. So that's our formal presentation, and now we can open it up to questions.
Commissioner, with that concern of the spikes we're seeing in other states that perhaps didn't take some of the safeguards that the state did in Erie County, what are your concerns as we are now in this bigger reopen phase of phase 3 with dining and a lot of people getting together? What are your concerns about what's going to happen here?
Well, I think everybody is rightly concerned that we could start to see spikes again like they have in other states. However, we know how to do it right. I mean, we know what to do, and we've seen from our numbers that what we're doing is working. Masks I can't emphasize how important masks are to prevent infection, especially for people who have COVID-19. We know that at least a third of people infected with COVID-19 don't have any symptoms, don't know they're infected, and so if they're wearing a mask, they significantly reduce possible transmission to other people, even though they don't have symptoms. And then for people wearing masks that aren't infected, it also acts as a barrier for them, a barrier protection for them. So masks are super important. Now, remember, keeping the numbers down. We've seen, photos in other states of like huge crowds, huge gatherings. We don't want to do that. We want to avoid it. Keep it in the small groups, and remember social distancing when we're going out in the beautiful parks and our beautiful beaches, or wherever you're going, outdoors to eating at restaurants or indoors in restaurants. Make sure that you stay 6 feet apart from other people that don't live in your household. Including in the restaurants. Make sure the tables are 6 feet apart. So we know what to do. We know what works. I know everybody's getting fatigued, but however, COVID-19 is not getting fatigued. It's still here, and we have to do what we can to protect ourselves and protect our community.
In the past, Dr. Burstein, we've talked about, sunlight exposure, and I know we focus a lot here on the summertime. It's nice out, people in Western New York can go outside, but you look at kind of what's happening in the South and Arizona, Florida, in a lot of cases, June doesn't mean it's comfortable outside. People want to stay inside during the summer. Is there something to be read into that, that you can see where, being indoors in southern states is actually causing part of the rise along with the mask issue that you just addressed?
Right. Well, I think the rise of COVID-19 cases in the southern states has to be attributed to a variety of behaviors. So, the pictures that, I see what you see on the news, the pictures we see of, large groups of people not wearing masks, whether they're indoors or outdoors. I think the masks are really important. And again, there's a lot of things that we can do to minimize our risk. So in addition to masks and social distancing, keeping in small groups, the outdoors provides the opportunity for those infected droplets, if there are any, to kind of get blown away, disappear into the atmosphere. Whereas if you're indoors, depending on the circulation in the room, they can fester and remain a long time, depending on the type of droplet, how large it is, and also the the viral load of the individual that's infected. So that's being indoors is one risk factor, and one way we can reduce our risk, harm reduction, is doing as much as we can outdoors. Again, it's not any one thing, it's a group of things. We have to continue to do everything, including the masks and the social distancing and the hand washing and small groups and outdoors if possible. It's a package. And I know it's people are tired of it, but COVID-19 is still here. And in the South shows us what will happen if we let our guard down.
In light of the increasing the declines that we've been continually seeing, how optimistic are you regarding our progress toward reopening in phase 4? And in general, do you have any insights on what we've seen, or has there been any surprises in what we've seen regarding our data and the declines that we've seen over the past few weeks?
Well, I think that what I'm particularly optimistic about as we continue to open up businesses and restaurants and recreational facilities in phase 2 and now phase 3, our numbers continue to decline. And it's not because we're not testing enough people. We've never tested more people in Erie County as we have in the past week or two, and so we are being aggressive about trying to identify as many cases as we can, and then make sure we conduct a thorough case investigation and identify all the contacts. And this is really complicated now because so many businesses are reopening, and so we have to work with the businesses to try to identify of their employee, who were the close contacts that they had while they were working, as not just other coworkers, but also could be customers in the store, and they were close contacts. So that's somebody who was within 6 feet of an individual for 10 minutes or more. So this is something that's really difficult, takes multiple phone calls with the businesses, and we have to do a good job of this because we want our numbers to continue to decrease. And I think, again, that's, everything that we're doing, we're really excited that our numbers are continuing to decrease, and we have to keep it up. And as more businesses open up, it creates some more work for the health department, just in terms of the complexity for the case investigations and identifying the contacts and putting them all in quarantine and figuring out if they're essential employees or non-essential employees, and and we're doing it so far. So again, if anybody, any of your viewers are work in businesses or business owners or HR, expect you could be receiving a call from the Erie County Health Department, and please help work with us and identify people that could have been exposed in your business, and to keep our community healthy.
Commissioner, we are a little over 2 weeks out from the first round of protests. Are we seeing any cases directly linked to that first weekend?
You're right. We are 2 weeks out from the beginning of our protests. As you see the numbers, so far we've seen a general decline. I'm not in the weeds with the data, so I can't tell you if there was, what proportion of those positives were directly linked to the protests. And even if individuals were in the protests, we know that they were probably other places too, so we can't say there's a direct cause and effect. However, I know that in the most recent protests, people were very smart. They were wearing masks, and I think what we're seeing now is our numbers continue to decline, and so people were being smart, and masks are protective.
Are you seeing, Doctor, an increasing problem where people aren't showing up for their testing appointments?
We usually book anywhere between about maybe 140 people to be tested for our diagnostic testing 3 times weekly, and usually about 20, 25 people don't show. However, we do get last-minute appointments for people who are contacts that want to get tested. We want all close contacts to get tested for COVID-19, and then people who are symptomatic, and so we fit them in. So, usually we do have a little bit less tested than we're scheduled. That's why we're reaching out and letting people know that if you do schedule a test, please keep the appointment or let us know that you're not going to show.
Why do you think that's happening? Do you have a theory as to why that might be?
We do call all those individuals that don't show, and usually they don't answer the phone, so I don't have any direct data to explain why they might not have showed up. I mean, it could be that they didn't have symptoms for the diagnostic testing and something else came up and they decided to forego the test. And with the antibody testing, they may have decided it's a nice day, there's something else I'd rather do. I can't really explain it. However, it's a service that we're trying very hard to offer to Erie County residents, so I hope if they call and make the appointment that they keep the test on track.
Is there something that you believe that the public should be doing to try to build their immune systems? We see the hospitalizations go down, but there's always the lingering concern of a second wave. Building an immune system, I assume, would help stop that. What should people do?
We know that, in general, if, people are healthier, they have a more robust immune system. So, eating right, getting some exercises, getting plenty of sleep, those are all really important to keep your body healthy and including keeping your immune system healthy. So, just be wary of these products advertised that says they boost your immune system. Many of those have not shown to be effective. So just, common sense things, good sleep, good food, good activity is what you can do to boost your immune system. And again, despite whatever you do, there are, we see a decline in immune response with aging, and there's nothing you can do about that. However, within whatever age group you are, you can stay healthy to keep your immune system as strong as possible.
We were wondering, do you have the number of how many complaints the county has received regarding businesses violating reopening rules? And if not, could you just talk a little bit about what happens when you receive a complaint like that?
Sure. So I don't have that number offhand, and we can get that to you after this press conference. So it depends on the type of business. So for restaurants, we send our environmental health, public health sanitarians to investigate. It starts with a phone call. Calling the facility. Finding out what's going on, and then we follow up with an on-site inspection. And then depending on what's going on, we may give them a violation, or we have had to give, I think, 4 close orders so far. Those all occurred before phase 1, and we have given a couple violations since then. And usually restaurants have been very good of correcting the problem on site. Usually it's been like a crowding issue, and more recently, and voluntarily emptying out the facility. Some of the places we've been to had actually emptied out voluntarily and closed before we even arrived. So I think most of the restaurants and bars understand what the right thing to do is, and are trying hard to comply. It's difficult to control crowds. If it's another type of business, then that's actually, we have to work with the local municipality, and the building code inspector would work with law enforcement to work with that facility and making sure that they're doing the right thing, and if they need to, they would have to close them down.
What will you do this weekend with Bennett Beach opening? How will you make sure we don't see scenes of, I know it's a much smaller beach and what we see in other cities and states, but how will you crowd control that so people aren't, blanket to blanket and
Gonna
really...
turn that over to Troy.
Thank you, Doctor.
So I think our approach is going to be education. We have our park rangers scheduled to be at the beach this weekend. We have Evans PD and Erie County Sheriffs to be at the beach this weekend. And it really comes down to education. We have signage up about 50% capacity, 10 feet on, like I said on the slide, 10 feet on blankets and 6 feet up with people. So we're just trying to educate people as they come to the park to let them know what those new mandates are. I think the doctor says it right on. We know what works. We know what we're supposed to be doing. Now it's a matter of doing that. So we're just asking for compliance, whether you're playing disc golf or at the dog park. If there's overcrowding, go somewhere else. There's other beaches and other places you can go and other waterfront parks. So at Swimming at Bennett, we to say we're not concerned about it certainly, but we've taken steps in signage and have our park rangers and other law enforcement there to help educate them.
Just a follow-up to that, what is the capacity at Bennett Beach? You know, when we have that, do you anticipate actually reaching that capacity? Then what, you just tell people, sorry, we're full?
Well, we'll try to educate them. If we have to work with the Erie County Sheriffs or Evans PD and close the lockdown, we may have to do that. We hope we don't have to do that. The forecast is a beautiful, like all week, it's a beautiful forecast. The capacity is 450. The actual capacity is 900, so technically 450 people are allowed at Bennett Beach.
Troy, I think you explained it, but I missed it. What's the reasoning for increasing the number of tee times on the golf courses?
Well, early on, we spaced them out for social distancing. Early on, before we had golf carts, we spaced our tee times out to increase social distancing and the lack of people coming together in close proximity. Now that we have some golf carts and other phases are open, we're moving those tee times, working on moving, not yet, but working on moving those tee times a little closer together to allow more golf play.
Would that create maybe more congregation?
No.
Tee times are closer together, perhaps?
We don't anticipate that. Remember when that first came out, it was groups 10 and less and smaller group sizes. So with some of the reopenings and some of the new mandates, we think we can still achieve those by moving those closer together.
In regard to youth sports and the parks.
Sure.
For the sports that aren't permitted to open on July 6th, for example, if a group of 24 people or less wanted to play basketball in one of your parks, what's stopping them from doing that?
Well, there's two things. One, if it's a youth sport or a group, we're not issuing special event permits. So to run a league or a group or a little league soccer, or you need a special event permit. We're not issuing special event permits because that limits the possibility of large groups of people, including parents or spectators, being in the same location. So what we're asking for in those locations, and typically our basketball hoops is not a huge concern at their locations, is basically what we've opened are typically sports where disc golf, a few people can, tennis, playgrounds where it's not large groups of people. Typically, if you're X municipality and want to play in a group and you need a special event permit, we're not issuing those. We're not taking that precaution at this time just to issue special. That goes with the buildings and shelters as well. We're just not going to open that can of worms yet.
Troy, just a quick clarification. With Bennett Beach, is it open Friday or Saturday?
Friday.
Okay.
It's
You
open
mentioned
Friday.
Saturday during your-
Yeah, I'm sorry. It'll be open. It opens Friday at 11 o'clock for swimming, 11 to 7.
I had a follow-up question for Dr. Burstein. First of all, those bar charts are very interesting. For the confirmed cases of COVID-19 as well as deaths, can I get the raw numbers that you use for those charts, which are really small bars that the numbers aren't on there?
Sure, we can send that to you.
And then there is a big difference between the number of confirmed Buffalo residents who have COVID-19 and the number of deaths. The number of deaths is very proportional, city and suburbs, where the number of confirmed cases is far more city than suburban and rural communities. Do you think that could be, what is your reasoning what do you think that's behind that? Could it be access to testing perhaps?
These are surveillance data. So first of all, basic tenets with surveillance data is you don't have a positive test unless you get tested. So it could be because of people's testing behaviors. I think there is good access to testing in the city of Buffalo. There's good access to testing outside the city of Buffalo. So it's if people choose to get tested or not. Also it's situations where people are living. We know that in areas of Buffalo there's areas where higher poverty forces more people to live in smaller spaces. So there's more opportunity for disease transmission in those smaller spaces, and there could be large families living in one home. So it's very easy to transmit infection within the home and jack up the numbers that way. So it's again, it's very difficult to explain all the reasons. We do know that again there is a disparity there, and it's probably an a variety of things.
They're not dying at a disproportionate rate, though.
Right.
So it seems like there are far more people who are getting infected or testing positive, but proportionally a much smaller number of city residents who are actually dying.
Right. So the numbers, the data that we gave of like all the people who were infected with COVID-19, what proportion lived in the Erie County, what proportion lived inside the city of Buffalo, and what proportion lived outside the city of Buffalo. And then again, of all the people who died of COVID-19, is what proportion lived inside the city of Buffalo and what proportion lived outside the city of Buffalo. So remember, with deaths, there are a lot of different variables with that. There is age, there are comorbidities, so so it's not just location. So there are a variety of factors that contribute to the demographics of the people who are infected and the people that suffer from mortality with COVID-19. So I don't think there's like one easy answer.
Do you foresee people having to wear masks and do all the social distancing stuff until there's a vaccine? And once there's a vaccine, what percentage of the population has to get it in order for herd immunity to work and everybody to be actually safe?
Right. So the experts calculate that to achieve herd immunity, we have to have about, I think, 2/3 of the population protected, about 60 some odd %. And so that's what we're hoping for. But we hope that even after we achieve herd immunity in our community, some of the behaviors that we've adopted to protect ourselves and our community from COVID-19 stick, because they also protect us from other infectious diseases, right? I mean, flu isn't going to be going away this winter, and the regular cold, other respiratory viruses, other GI bugs that cause outbreaks. So wearing a mask, washing our hands, social distancing will help protect, and staying at home. Number one, like stay at home when you're sick, keep your kids home from school when they're sick. I mean, all those will continue to keep us healthy even when we have a COVID vaccine.
Seneca Niagara is opening up tomorrow. I know Niagara County is not your jurisdiction, but Seneca Buffalo is opening up next Thursday. Do you have any advice for people planning to go to casinos, aside from wearing masks and social distancing guidelines? Do you think there's anything unique to people going to a casino in particular?
Well, so people who are going into casinos are going to a number one risky area. It's an indoor space. We want to make sure that it could potentially be crowded, and then also you don't know what other people have on their hands, and so it's really important that people make sure that in addition to wearing masks and try to social distance as much as possible, that they bring a good hand sanitizer and making sure that they spritz their hand every single time they touch something, whether a slot machine or cards or dice or money or coins. You don't know what the last person who touched those items had on their hands. So it's really important to remember to wash your hands, and then try not to touch your face with your mouth or your nose or your eyes, because those are portals of entry for COVID-19. So again, try to be safe, and I don't know if there's any outdoor gambling or those type of activities, but anything that you can do as harm reduction and minimizing your risk is really the best option.
Do you know if the county has any jurisdiction to enforce things, because it's a Seneca casino?
I will have to get back to you on that. Good question.
Dr., on the low-risk youth sports, you referenced that even the practices are off limits until July 6th. And I think there was confusion on that. Because I know, for instance, the town of Clarence had Ball Diamonds and courts opened up, and they're now going to be closing those down. Are you finding that there was confusion on that, and have you worked with a number of municipalities on that issue?
Yes, when we learn of some type of youth sports activities occurring in a municipality, we contact that municipality and advise them of what the governor's executive orders and the Empire State Development allow, and it's really up to them to enforce those activities in their own jurisdictions.
Do you know, on that same note about youth sports, with pools opening up, are swim lessons allowed?
I'll have to get back to you on that. I think, again, if, keeping, social distancing crowds under 10 people, I'll have to get back to you on that. Good question. I'm not sure if that's spelled out in the regulations. We'll check.
Anything else? All right, thanks a lot.
All right, remember,